Okay, start from the beginning.
Start from the
we don't
beginning.
even know what you're talking about.
Okay.
Yeah. And where you're,
All right, right there on the inferior angle, and then I'm just kind of gently pushing down. Feel that stretch? Doesn't hurt. And then we'll cup the GH joint again with your right hand. Put right here on the inferior angle of the spine or the scapula, and you're moving it medially. And then you'll do the inferior angle the same way, where you just gently pull it down like this.
This feels good.
Yeah. And then I do this not only in prone, but I do it in side lying as well, with the therapist in the front, and then I'll be in the behind. And I'll use 3 different areas there too. And then I'll go through the GH joint things the same way.
show it.
Fair enough. All right, so if that's feeling pretty good, we're not done yet. I'll just go through the whole process here. I'll cup this area too, and I'll check the anterior capsule and just kind of inchly rotate to free any restrictions you may have there. And I'm also palpating and putting a little bit of pressure on that area, because you've got to clear the scapula first, like you talked about, the thoracic scapula, and then I'll work my way around the glenohumeral joint. Then you'll work the SCAC and all that later. But this is just primarily the original one. And then let's have you line your side. Yeah. So we'll have them kind of right here in front. And then this is going to be difficult. I'll put my hands kind of right here, and you'll abduct the shoulder just a little bit. And then grab a hold right here, and I'll do the same 3 angles again. Just like this. And then I'll slowly abduct the shoulder a little bit more each and every time, just kind of working that shoulder blade. And it's kind of laborious. I mean, it will wear you out, because I do this for like 30 minutes on and off throughout this whole program. And then we'll just kind of gently do this area. Then I'll clear out the what they call a ratchet. We'll have them relax. And we'll check to see if he has any restrictions. And I'll work superior and inferior. And I'll just gently kind of rotate a little bit there too. But I like good posterior capsule stretches like you were talking about, because it's always a good area to work. And then I'll reverse and twist it back. So then I'll just pull in their pants a little bit and have them pull back. Come back a little bit. There you go. And then I always try to support them too, to let them know that I'm behind them, they're not going to fall over. So again, I'll kind of cup this area here. And this is the one that makes them feel the best, where I'll just kind of really work that thing around. Just kind of back and forth. Feels pretty good, doesn't it? Just to kind of loosen it up. And you'll feel little cracks and pops and things like that. That's those areas that are just releasing.
Patients move like that, they wouldn't need you.
So that's pretty much the scapular portion of it, and then I'll work more GH.
And what was the lady's name? Yeah.
Dora Partridge. She has a website.
Can you tell him?
Dora Partridge.